Hello guys, now we shall be discussing regarding herpes simplex virus type. Okay, so our topic of discussion will be herpes simplex virus type 2. Okay, herpes simplex virus type 2. Now, all of you know that I have already spoke before that all these herpes viruses, like herpes, there are 8 different types, 1, 2, 3, 4, 5, 6, 7, 8. In all of these 8, the similar thing is they belong to Herpesviridae family, and all of them have an enveloped double-stranded linear DNA. Okay, so what did I tell you right? I told you that all of them belong to Herpesviridae family. All of them belong to Herpesviridae family. Second important thing is that if you look at the DNA of any herpes virus, herpes simplex virus type 1, type 2, type 3, and any herpes simplex virus you take, the DNA will be like this. Normally the DNA is coiled, right, in all of us. So this DNA will be like this. First thing, DNA is double stranded here, isn't it? 2 strands are there, and this DNA is not coiled, it is straight linear DNA. And this DNA is surrounded by, what is this? This is called as an envelope. So if there is no envelope, you call it as a naked DNA. If there is envelope, you call it as an enveloped DNA. So if I wanted to write about this, how will I write? It is a double-stranded DNA. Okay. And the DNA is linear. Next, it is envelope. So try to follow these 3 things for all the herpes viruses. Okay. Next important thing is that this herpes simplex virus 2 is the most common cause for recurrent genital ulcers. Okay, so this herpes simplex virus type 2 mostly causes or responsible for recurrent genital ulcers. Recurrent genital ulcers. Now when I tell recurrent genital ulcers, the recurrent means they are again and again occurring. Genital ulcers, you know, these genital ulcers are so painful, so much painful, right? There are ulcers that are formed on the female genitals as well as male genitals, and they are really painful ulcers. So if you see any patient complaining of painful ulcers on the genitals, then always think of HSV-2 virus. Okay, so let us discuss the transmission of this, how it is transmitted. So what is the transmission route of this virus? Obviously I am telling you mostly it causes genital ulcers. It means what will be the way of transmission? Way of transmission will be sexual contact. Sexual contact. Okay, not only that, perinatally as well. Sexual contact and perinatally. These are the 2 risk factors or the transmission, the modes of transmission. Next important thing is that how is the pathogenesis, how this virus is going to enter into your body. Pathogenesis. Now when it comes to pathogenesis, important thing you need to know is that this virus mainly passes through the fluids. Anything that is mucus like or the fluid like. So the body fluids from the eyes, from the nose, from the mouth, from the genitals. So these all are covered with the mucus layer. So all these things are having fluids in it, a rich amount of fluid. So these viruses also pass through them. Okay, so the first attack will be from the mucous membranes, let us say from the mouth. So most commonly the highest risk factor will be oral sex, isn't it? So patients with oral sex might definitely have this herpes simplex virus type 2. So mainly the transmission will be through the mucous membranes. So once it enters into the mucous membranes, it is going to multiply in the epithelial cells. From there it is going to go to your central nervous system, your spinal cord, and it will stay there, sleep there in the spinal cord. And again, when you reactivate it, it will jump into the system and it will damage your all the organs and all. It will affect your genitals, it will affect your eyes, it will affect your skin and all. Okay. Now, what did I just tell you? What I just told you is that, let me draw a picture and explain what I told you. Right. Now, in this patient, if you see, guys, let us write it as a mucus. So I'm putting a barrier here, and I'm writing this as mucous membrane. So this is, let us say, this is mucus. Okay. This is a mucous membrane layer. And let us also draw this central nervous system over here. This is a central nervous system. So this is the central nervous system. Okay. Now what I'm doing is I'm just cutting the section of spinal cord and I'm showing it to you here. Right. So how does a section of spinal cord look? So this is a spinal canal. This is a spinal cord over here. Okay. Now this is how it looks. Okay. Now look here. Exactly here you have got this thing. This is called as a dorsal root ganglion. I hope all of you know what is dorsal root ganglion, right? So dorsal root ganglion, in the sense, the neurons here, normally you see a neuron like this, unipolar neuron, right? It will have a cell body, it will have an axon down and then dendrites here, right? I mean the axon terminals there. This is a cell normal neuron. But there are some other neurons called pseudo unipolar neurons. This is how they look. This is the cell body, this is an axon. And axon divides into a peripheral branch, it will divide into a central branch. So this is a peripheral branch, this is a central branch. Okay, the same thing here. So this is a cell body, peripheral branch, and the central is coming into the spinal cord. Okay, this is called as pseudo unipolar neurons. They are basically present in a thing called as dorsal root ganglion. All the cell bodies, see, these are the cell bodies, isn't it? I hope you know, but for those of the students who don't know, so this would be the explanation. So this is a cell body. So let us say 1000 cell bodies like this joined together, and that you call it as a ganglion. So 1000 cell bodies joined together and that you call it as a ganglion. That is present on the dorsal side, so dorsal root ganglion. Right? Now, what am I trying to explain you is that, let us say this is herpes simplex virus. This is your herpes simplex virus type 2. From the mucosa, from the oral mucosa, let us say, this virus can enter into your body. From there, straight away it will go to your spinal cord. Okay, but before that, what is happening? Before that, what is happening is that I just want to make an outline of this. Zoom this mucosa layer. Look here, guys. In this mucosa layer, you have got many epithelial cells, isn't it? These are the epithelial lining of the mucosa. These are the epithelial cells like this within the mucosa. Now, where is your virus? The virus is inside the mucosa like this, hiding inside the mucosa. The epithelial cells of the mucosa. It has just now crossed. Now, within these epithelial cells, it will multiply. The virus will multiply like this. The virus will multiply within the epithelial cells of your mucosa. So, where is the virus multiplication happening? The virus multiplication is happening within the epithelial cells of your mucosa. Now, once they sufficiently multiply, then now the virus goes into your spinal cord. Now, within the spinal cord, the virus will sleep. So, the virus will enter over here into the dorsal root ganglion like this. Once after entering into the dorsal root ganglion, it will undergo dormancy. Right? It will undergo a stage called as dormant stage. It means it is going to sleep there for a lot of time. Unless and until you reactivate it, it will sleep there. Okay, so virus is sleeping where? Virus is getting dormant where? But before that, let me write down the total story. So we have discussed that HSV type 2 has crossed what? Mucous membranes. Has crossed mucous membranes. After crossing the mucous membranes, it undergoed multiplication. It undergoed multiplication in the epithelial cells. In the epithelial cells of the mucous membrane. Now, after undergoing multiplication in the epithelial cells of the mucous membrane, the virus all the way reached your spinal cord. Spinal cord. Now, from there, it went into the dorsal root ganglion. Within this dorsal root ganglion, the virus underwent dormancy. So, dormant stages, it means the virus is sleeping in the dorsal root ganglion. Now, whenever there is any kind of stress factor, okay, for example, emotional stress, or let us say immunodeficiency, mostly immunodeficiency. For example, if let us say I have a patient, he had some unprotected sex, and but anyways, he had an unprotected sex with a female who is already having herpes. So obviously, he will also get the herpes. In addition to that, 2 years back itself, he was diagnosed with HIV. So already he has HIV. He participated in an unprotected sex and got a new disease that is called herpes. Now he has HIV and herpes. Right now, in this patient, herpes infection was sleeping in his dorsal root ganglion. But because of this HIV, which is an immunodeficiency state, the immune system became weak, and herpes simplex virus from the dorsal root ganglion have undergone reactivation, and it will affect this person. So if you look at the presentation, so we have discussed the pathogenesis, right? Now let's look at the presentation. How will the patient present to you? The first thing is, patient will definitely have a painful genital ulcers. Painful genital ulcers. Second important thing is that patient will have difficulty urination because the ulcers are there. So as the urine is passing, patient will have very difficulty in urination, dysuria. Not only that, patient will also have inguinal lymphadenopathy, swelling of inguinal lymphadenopathy. Inguinal lymphadenopathy. So let us look at the diagnosis now. Now in the diagnostic part, what is the important thing you need to know? Obviously, this is a virus, so I will do a viral culture first of all. Viral culture I will do. Second important thing is that I do a PCR also. Third important thing is that I do a very important test that is called as, in that test, I would look at the Zank smear. So in the Zank smear analysis, what will I find? In the Zank smear analysis, what will I find? What will I find is that, look here guys, what is Zank smear test? Within that Zank smear test, what will you find is that this is a neutrophil. Whatever I am drawing right now, let us say this is a neutrophil. Okay, this is a neutrophil. So this virus loves to attack the neutrophil. Once after attacking the neutrophil, it will start replicating in the neutrophil. Okay, once it starts replicating in the neutrophil, if you look, there will be some random bodies like this. So scientists have taken up these bodies and looked what it is made up of, right? So obviously they are made up of nucleic acid as well as proteins. Nucleic acid as well as proteins. Now these bodies, they called it as viral inclusion bodies. They called it as viral inclusion bodies. Okay, the other name that they have given to these bodies are cow dry type A bodies. Cow dry type A bodies. Okay, where do you find this cow dry type A bodies? You will find in herpes simplex virus 2, as we discussed now. Not only that, even in herpes simplex virus 1, not only that, even in varicella zoster virus also you find these bodies. This is very, very important. Where do you find these bodies? Varicella zoster virus, herpes simplex virus 1 and 2. You find these bodies. So let me show you these bodies, guys. So these are the bodies over here. So these bodies are called as cow dry bodies, and this is the female genital tract. Now in this female genitalia, you can see ulcerations everywhere, right? So these are called as the genital herpes ulcerations. Okay, so this is all the important thing which you need to know regarding the herpes simplex virus type 2. Thank you so much for watching my video. Goodbye.